The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm very excited for today's guest, returning guest. It took me a minute to remember who we had coming on today, but as soon as I saw the site, which is skfpracticesolutions.com, remembered who it is. You're going to love today's program, especially if you're an Open Dental user or you're thinking about Open Dental. Brittany Rogars, say hello to everyone.
Well, hello, everybody. So happy to be back. I'm so excited to be back on the show. I know we had a blast the first time and always good to come back for a second.
Now, I think within 30 seconds of the opening of the show, I think I mispronounced your name. Did I?
You did, but everybody does.
It's okay. Rogars, correct?
Yeah.
I knew it as soon as I said it. I am so sorry. Brittany, now that we've got your name right, we know where you're from. Tell us, how'd you get to be an expert in your niche? It's such a cool niche. Tell me, how'd you get to be an expert there? What's your journey been like so far?
Yeah, so I fell into this just sheer dumb luck, but I think that's kind of the way that the best things happen sometimes, is that you kind of just stumble into the right thing. So I took a job in dentistry, and about 4 days after I started, I found out I was pregnant with a kiddo, which my employer, I'm sure, loved.
Yeah, I'm sure.
Yeah, but it was a second back-to-back pregnancy. My first one was really tough, so I wound up getting put on bed rest very early on. And my employer, thankful for them to this day, they said, well, take this time where you're stuck at home and master this open dental program that we just heard about, because we're going to convert when you get back. Wow. So yeah, so they really invested in me, and I think it paid off pretty well for them too, because I came back and I helped them convert one practice. And then as they acquired practices, I think we were up to like 10 or 12 when I left, we converted every single one of those practices to open dental as well. So I knew the software inside and out, and I knew how to train on it really well. So It worked out pretty nicely.
That's awesome, Brittany. That's great. So you were in a practice. I'm just going to recap here. Mm-hmm. You went out on maternity leave, and instead of the practice just being upset that you were gone or trying to figure out how to replace you, they actually figured out a way how they could 10x what you could do in that practice, right? I mean, that's the big lesson here, right? Is there's certainly ways to make sun when it's raining, right?
Yeah, they got so creative, and not only were they able to like capitalize on that, but it was the reason why I stayed with them for as long as I did, was because of that initial investment that they made too. So I think it was a super great decision on their part, super smart business move.
Kudos. If you want to get a shout out to that practice, you can. We can do it at the end if you want.
Dental Partners. Yeah, we love them.
Yeah, awesome. All right. So here you are today. You are the leading expert, or a leading expert, in open dental training and software solutions for dental teams. So let's get into the heart of the program today. What's a big problem that dentists are having that we need to talk about today, that we need to get them solutions that they can move forward and put into action?
So I was thinking long and hard, and I wanted to try and come up with an answer that was different than last time, but I do really think it's still the same thing. And I think it's actually compounded since last time I was on. And that's that people just don't understand that open dental is different than every other practice management software, in that it is so stinking customizable that we can make it so no two softwares look the same, and it can work so well for your practice flow. Mm-hmm. You don't have to try and modify your flow to fit the software.
What's that look like?
That's a great question.
Yeah.
If we were working with a conversion client, as an example, we analyzed their top 100 most billed codes and how they use them in conjunction with each other, so we can build chart buttons that mirror exactly that and get rid of the noise. We can build out dummy codes and automations that fit the flow of the practice as well. We can build out all of the templates for their auto notes, for their custom sheets for their patients to fill out, even their schedule that fits the flow of that office. And it all really begins with analyzing how the practice works and then building out the software to match it.
Yep. Now, I'm guessing, and correct me if I'm wrong here, that you've also have experience working with other practice management softwares outside of Open Dental, right?
Unfortunately, yes. Not nearly as much as Open Dental, obviously, but being in a conversion type of industry, I have to learn the other softwares to know how
Yep.
to apply it to the Open Dental database as well.
Yep. So in our marketing business, we use a CRM. It's very similar to a practice management software, right? So CRM and other places. So a lot of you probably know that term, and it's where we track everything. It's where we keep track of our projects, everything that's going on, due dates, tasks, that sort of thing. It's very, very important. And I was asked by somebody else in a different agency, what do you think about the CRM that you're using? We're with this one. We're thinking about switching. And my response to them was probably need to dial in your systems first, not worry about the software. So I kind of look at it as there's like 3 P's, right? So you have your procedures, you have your people, and then you have your projects or your products, and your product being your practice management software. How often is the problem the people, right? And I'm not pointing out individuals, it's usually leadership and training, but is it the people or the procedure and not the actual software? And I know you love Open Dental, so you're going to be biased, but tell me about that. How often do you see that the problem's the people and the procedures?
I think a lot of times when I dig into these, I'd say most of the time when we dig into these conversions, we find that the software switch or the transition is a band-aid on the actual problem. So I'd say almost always there are underlying issues in the people or the policies. As I'm analyzing these databases, I'm asking for their SOPs and all of the things that they have in their office so we can build the software to match those SOPs. And more often than not, I get, well, what's an SOP, or what do you mean by this? And they just don't have any of that documentation. So I think almost always there's some underlying issue that we can work out on the operations side of things.
Sure.
And the software winds up being a band-aid for that.
Right. Yeah. Brittany, give me 3 things, 3 of those SOP related, right? How you're using the software, the procedures or the policies. Give me 3 things that you see that are big mistakes that are made commonly. It's always happening, that most likely a listener is doing it themselves or not doing it themselves. What are those big 3?
Are we looking for more operational, or do we want to go inside the software a little bit, or a combination of the two?
But yeah, you're the expert.
Okay, cool. So specifically in Open Dental, one thing that we're commonly seeing is unearned income or not allocating your payments appropriately, which then leads to this huge ripple effect of crazy accounting. And not only does the team not know how to read the ledger, but the patients don't understand what they're getting billed for. So trickle effect of tons of issues with your AR.
Yep.
I think having a standard set of checks and balances for who is taking care of what is become really popular right now and really important too. A lot of times it's like, well, the front desk handles claims.
Sure.
But if nobody at the front desk has actual ownership of that, then who's actually making sure it's getting done? So just having official ownership of things and like checks and balances for those is huge. And then I think one overall policy that or like protocol in general for the office that we're seeing a lot of people have issues with right now is just standardizing essentially the workflow of things. Like if I'm going to take off, who's going to cover for that? And how are we going to use our software to make sure that we're managing these things? So making sure that there's not only the checks and balances, but cross training and coverage for the teams on the back end of that.
Yep. One takeaway, something that every dentist that's using Open Dental, or maybe even other practice management softwares, but we'll try to keep it to Open Dental, that they're doing, what is one change they could make today that would make a significant impact on the output they get from their practice management software?
So I would say just blanket statement for any practice management software is you don't know what you don't know. So plug into the resources that are out there, because every single time I get on a call with someone and I do a training, it's not, oh, we click this one button and that's how we do the thing that they learn. It's watching how I navigate the software that they pick up something that we weren't even talking about.
Yeah.
So because you don't know what you don't know with any practice management software, plug into the Facebook groups, plug into the resources, come to my event in October, come to any event that they have for the software so you can learn all of the things that you don't know that are going to make your life so much easier.
Yeah, makes total sense to me. People want to check you out. I know on your website, again, it's skfpracticesolutions.com. There's a big button right in the center. It says schedule a free consultation. What happens during that consultation?
So we have a general intro call protocol. Actually, what actually happens is I wind up chatting your ear off and we become besties. But after that process, we ask about what your goals are. We ask you questions that help us align with what your office core values are, so we can make sure that we're customizing a solution specifically for you. And then we give you options on how we can work together, whether it be training or a comp exam or one-on-one coaching, any of these solutions that we have for you that we build out specifically for your practice to make sure that you're maximizing your software.
Love it. You got to check it out. It's skfpracticesolutions.com. Get the free consultation. This is good if you're using Open Dental, or even if you're not using Open Dental, right? You're considering using Open Dental. It's for both, correct?
Absolutely. Yeah. We have lots of intro calls with offices who are not even at the point where they're ready to switch, but they're just kind of weighing their options of if there could be a good fit for them in Open Dental. And those are some of my favorite calls.
Yep. I'm going to ask you one last question. We're going to leave it with this. And obviously, I don't want you to disclose information you can't disclose, but maybe, so we'll just say the last 10 clients that you worked with, one of them had some, probably most of them had some amazing breakthroughs in finances that were related to their practice management. Throw some numbers out there. Don't mention the practice by name, but tell me, what did that look like?
Well, that's funny that you should ask this question, because we just signed a client that we're going to start working with, and they had upwards of $60,000 in procedures that weren't billed to insurance companies that we were able to submit for them and we're starting to see payments come back in. And it's just because they didn't know to push this one button in their software. So we were able to submit those claims, get payments coming back in, and that's a huge amount of income, but also a huge amount of administrative burden that we were able to take off of their front desk, and money that we were able to get in for patients too. So huge win for us on that one.
That's amazing. Check it out, skfpracticesolutions.com. Brittany, we appreciate you being here so much.
Yeah, thank you so much for having me. Always a pleasure.